Good afternoon, everyone. Today I'll talk about corneal biomechanics and imaging of ocular structures using this novel technique called Brillouin spectroscopy. Well, what is biomechanics and why is it important? I mean, biomechanics is a way to measure elastic properties of tissues such as crystalline lens or cornea in 3 dimensions, and our technology is able to do it in real time and with non-contact method. Usually, when you want to know how soft or hard something is, what do? You typically use your sense of touch. You squeeze things, you poke things, but the Brillouin spectroscopy allows you to use just light, which is a much more desirable approach to measuring properties of ocular tissues. And the system that we utilize is called BOSS, which is short for Brillouin Optical Scanning System, and it can non-invasively measure biomechanics of crystalline lens and the cornea. So we already received on the regulatory side CE mark approval as well as 510(k) clearance in the United States. We also have approvals in Korea and Canada. We're also preparing for submissions in China, Japan, and Australia. During the clinical beta program, we deployed about 30 machines around the world to establish basically traction and clinical utility and build sort of advocacy for use of biomechanics. There's a lot of papers that's been published, and we're also developing certain tools that can help physicians to take that new dimension of information and apply it to clinical practices. So we deployed about 30 machines out there, and there's been a lot of publications from various clinics and universities that show how this technology can be put into practice and what additional information it can give you. So what's so important about biomechanics? There's multiple applications and clinical utilities that our customers and partners have identified. So one obvious one is early diagnosis of corneal diseases such as PMD or keratoconus that was mentioned earlier. The earlier you can catch and intervene, obviously the less distortion is created on the eye optically, and you can prevent this optical distortion from happening if you can, for example, cross-link cornea at the earliest signs of the disease onset. Customization of cross-linking procedures and looking at effectiveness of cross-linking is another application that was found to be very useful. Usually people look at changes in Kmax when they see how well the corneal cross-linking procedure had worked, but with our technology you can actually see biomechanical changes induced on the eye very early as a few days after the procedure itself. So this can give you a preview into effectiveness of the procedure as well as allow you to potentially develop more customized procedures based on individual biomechanical properties of the eye. Another application that we found to be very important is refractive surgery. And there's a 2-factor where biomechanics plays a role. One is screening of patients that may have some asymmetries in their optics but perhaps very structurally sound, or vice versa, if the topography looks nice, but there might be some sort of hidden problems with the structural integrity of the tissue where the surgery would be counterindicated. A lot of different surgical techniques in refractive surgery, such as SMILE, PRK, LASIK, make certain claims about how biomechanically preserving their technique is. And now we have a tool to actually compare different procedures to see how much biomechanical changes are induced post-surgically and how do they vary depending on the amount of correction that's being placed. Additionally, we have done a lot of collaborations on presbyopia research where you can actually see changes in elastic properties of the crystalline lens under influence of certain molecules that were designed, for example, to soften the lens to address presbyopia. And finally, the customization of LRIs and AKs for refractive surgery, because obviously stiffer and softer cornea may react differently to the same incisions that you put into the eye. Now we also have shown proof of concept in measuring sclera. So scleral measurements may potentially identify early sort of signs of progressive myopia and allow intervention at that early stage before refractive error starts to manifest itself. The latest generation of the system that we're launching actually at this show has much faster acquisition times, gives you a little bit more detail on the cornea in terms of anterior versus posterior part of the cornea, how their stiffness profiles vary. And we're also going to have a OCT module that goes with BOSS system. So in one machine, you can have both shape and structure registered together in one exam. As we collect more and more data, we're developing various tools that can, for example, improve a refractive surgery nomogram. So, for example, we saw that people with soft and hard cornea react differently to the same type of refractive surgery. So, particularly for high myopes, knowing refractive error in addition to biomechanics may substantially reduce the number of outliers and retreatments. We're also looking at nomogram developments for AK and LRIs with some of our partners, as well as having more sensitive tests to detect early keratoconus. We have pretty positive feedback from our customers and advisors that see how this new machine can help them develop new procedures and provide much more comprehensive diagnostic information for their patients. Looking at the roadmap, in addition to kind of the diagnostic of various diseases, we're also looking at the therapeutic pathway to use changes in biomechanics to reshape the eye rather than removing or adding tissue and creating cuts, which obviously poses its own concerns. This is something that we already doing some feasibility work around. Just in summary, BOSS is a first of its kind, commercially available, non-contact biomechanics imaging tool that can measure biomechanics at pretty high speed. It has compatibility with OCT, which will be sold as an add-on module. And we're also developing tools for physicians that are taking data from the biomechanics and combining it with known other indications to have better refractive surgery planning, subclinical keratoconus detection, and nomogram for AKs and LRIs. So currently we're raising B3 round, but we're also exploring various partnerships on the clinical and commercial side. So I'll be happy to speak with you about that. And if you want to visit our booth, which is C1-214 at the SCRS, you can see the instrument for yourself. Thank you very much for your attention.